watching Rogers TV.
Alex Summers, Chief Officer of Health for Middlesex-London. You came by our ports, you and your lovely wife, in the summer, I remember, and we were talking about how to collaborate better between the food bank and the health unit, because it's been such a positive thing for us to work with you folks. And we do have somebody from the health unit on our board, Kim Lupus, which is awesome. You, like me, grew up in Calgary. Correct. So I remember that. But then you came to London, and was it Oak Ridge you went to, or Saunders?
It was Oak Ridge. So when I was 16, my parents moved our family from Calgary to southwestern Ontario. And so I was at Oak Ridge Secondary School for the last few years of high school. Then went off to university and was gone from London for a lot of years before.
So let me just interrupt you there. You went to university, yes, but you went to Queen's, University of Toronto.
Yeah.
And then if I remember properly, you spent some time at Harvard.
I did. Yeah, I did.
Wow, that's great. You didn't do too bad there, Dr. Summers. That's pretty awesome. Yeah. And then you came back to London, correct? What year was that?
So in 2018, July of 2018, I started as the Associate Medical Officer of Health here at the Health Unit. So I moved from Toronto to London in the summer of 2018 to start my work and career here.
Yeah. That's right. And then you became the chief officer was it 2 years ago, roughly around this time, wasn't it?
Yeah, roughly around this time. I stepped into an acting role just to fill in a gap in October of 2021, and then stepped into the role permanently in the late winter of 2022. So now almost 2 years in the permanent role.
Yeah. Okay, we've dealt with your background, which is very impressive, but I did want to ask you how that has been for you. I think for anybody, all the way from food banks to companies to politics to family life, whatever. COVID changed so much of what happened, and then as we came out of COVID, I think we've all discovered that it actually hasn't been all that much easier, right? I think for groups like food banks, for instance, our numbers have gone through the roof. I know other social services are dealing with it as well. And I'm not sure that we quite saw that coming, as COVID was ending. But there we are. How has it been for the health unit? I'm presuming it's pretty complicated and some pressure-filled stuff.
It's been a very complicated transition out of the pandemic. It's interesting. One of the things that we spent time on in 2020 while the pandemic was raging was thinking a little bit about what recovery might look like, not just for the health unit, but for the agency. And at the time, we dug into that because we knew that inevitably the impacts of the pandemic were felt well beyond when the acute risk of a infectious disease at least is somewhat mitigated. At the time, I don't think we knew the pandemic would go on, but I don't think we realized it would go on for as long as it would. And so not only is the recovery going to take much longer than anybody could have anticipated, it also came later than we would have expected. And so for us at the health unit, what we're experiencing is almost a complete resetting of culture and staff. People finding their way back to other aspects of public health work, of having to deal with the stressors that they inevitably experienced through the pandemic and the roles that they found themselves in. And that transitions to the burden of illness and challenge that we see in our community, and as a health unit, struggling with what to do about that. Homelessness has absolutely, as we know, exploded. Income disparity has worsened. Access to basic resources, given the resources that you have as an individual, has worsened massively. I don't think we fully unpacked the impact on a generation of children from the developmental impacts of trying to survive through a pandemic. Quite simply, this community and this country has not experienced something as disruptive to your everyday life as the pandemic since, one would argue, the Second World War. And that we need to account for that. We need to recognize that this recovery is big, and it's going to be slower than we ever would have anticipated.
Yeah, that pretty well sums it up. I do think definitely for public agencies, it's not been easy either. Like the food bank is not a public agency. We don't get government funding or anything like that. But when I think of things like hospitals or things like health units, you have to live under all of these lenses being focused on you from all these different sectors, right? And you somehow have to navigate that during a time when it's really confusing. I was in Ottawa during the Great Recession. For instance, it was going on, and trying to figure out how we're going to help communities, and it just became really complicated because all the eyes of the public and the media and others were upon us. Does that make it more difficult for you and your board and others to make decisions, or in some way does it kind of make it simpler because you know who your audience is?
It's harder. It's harder.
I would suspect.
Yeah, it's harder. I think, again, coming out of the pandemic, and we're seeing this for all civil servants and services, so be it hospital and healthcare services, public health services, police services, the list goes on and on. Frankly, garbage pickup, right? Municipal services. From it feels right now like we are all stretched to the limit with regards to delivering on the quality of services that people expect from us, given the resources and the costs of doing the work in 2024, right? And it's, we have experienced at the health unit, we, as we've come out of the pandemic, there was transitional funds, temporary funds to support us ramping up. Those funds are now away, but the burden and the population growth remains. And so that has meant very, very hard conversations and frankly, hard decisions about the work that we're able to do. Just as an example, Glen, in 2011, our per capita funding as a health unit was around $58 per person. So for every person in Middlesex-London, we had about $58 to play with. If you fast forward a decade to 2021, and our funding had kept pace with inflation and population growth, we would have been sitting around $68 per person in terms of funding. In 2021, our actual per capita funding had actually fallen to $55 per person.
So went down.
Went down because of population growth and other challenges. So that was 2021. It's worse now. I mean, it's accented now. And what it means is that we have what I call a structural deficit with regards to a mismatch between the work and the expectations of the work versus the revenue that we have. And so we quite simply cannot do the same stuff that we were doing in 2011, let alone 2015. And so that means some really hard conversations, some really hard decisions. Like I know I raise this not, our elected governments, our funders, they have massive priorities. Every single dollar that a government takes in is a dollar from somebody. Like all of this, these are not easy conversations, and I don't pretend to have all the answers at all. What I can articulate, though, is just that we can only as an agency deliver on what we can possibly deliver on, and we need to do it efficiently and effectively and be well managed and fiscally responsible and committed with all of it. And we are, and I think we can demonstrate that, as can many public agencies. But we're not the only ones, but it makes it hard to do that work. What we've experienced and found, though, is that when you really are transparent and clear with people around what you're experiencing, and you stay to the truth and the facts and you don't try to spin anything, people seem to respect that and figure it out a little bit. But yeah, it's been hard, Glenn. It's been hard.
Yes, and it's been hard for us too as a food bank. Our numbers have gone up 91% in 2 years.
Yes.
Right. So 43% over the course of the last year. We had a terrific year last year as far as donations went. It was, it was the largest we have ever had. But it doesn't come close to the demand that we're facing. No. Right. And the public is doing its best to try to fit in their businesses and others. We don't get government funding, but they're in there all trying to do whatever they can. But the difference for us is, I think, is that people know that we're doing the best we can with what we have, but we've always got the public entering in, trying to help, so on and so forth. I would have to think that being in a health unit, you're kind of in more of a fixed position. It's not as mobile. You're depending on this kind of funding, just as you said, per person, per capita, for what you need. And if things have changed and economic times have changed, you have to live within that construct. And that can't be easy for you. So anyway, can we talk about food for a bit? Because the show is called Food Bites, and
you bet,
we probably should. I did want to talk about that because I think, Jane and I have been at the London Food Bank for almost 40 years now. So we were there at the beginning of the food bank movement. And back then the idea was nutrition is very important. But what we're going through in this recession, this was in the 80s, what we're going through in the recession, we'll get over that, and then things will get back to normal. And that didn't happen. And suddenly food banks got bigger, and suddenly there got to be more of them. Originally, there were only 7 of us in Canada as food banks, right? And Calgary was one of them. And so we worked our way through that. But now, after all of these years and all of the challenges, like the many recessions, the Great Recession, the pandemic, it's now become clear that in the past, 20 years ago, the thing was we've got to give people better nutrition, right? Like that's just really important. That was really the choice we're making. So as a food bank, we began moving more towards green food, fresh food, that kind of stuff. So that part makes a lot of sense, and we know that it's right. But we've now entered an era in which the issue isn't so much nutrition, although it will always be about nutrition. It's about availability, right? That's really something. And I know that for the health unit, the issue now isn't just about education. And help me if I've got this wrong, Alex. It's not just about education, about nutrition and making nutritious choices for your kids, for your families, for your parents, that kind of stuff. It really is about, is food accessible? That people need or that people have. And I think that has become a key thing. And I did notice here that, just 2 or 3 weeks ago, you and another public health officer spoke out on this very issue about the food security itself is a key thing. And I'm not sure, maybe you can help me, but was that an issue in the past more for health units, or was it just more about nutrition? Because now it seems to me about nutrition, but if you can get it. Does that make sense?
Absolutely. So if we think about, we know that access to healthy and affordable food is critical. And, a big part of what we've done as public health over the years is focus on what we call food literacy, which is, again, informing and teaching people around how to eat well, pick the, how to eat in a balanced way that avoids chronic diseases like diabetes, heart disease, et cetera, right? And we've done that through, broad social marketing campaigns, embedding ourselves in secondary schools, a whole bunch of stuff. But the primary reason that folks are not having adequate nutrition in 2024 is not because they don't know. I think that's still an ongoing thing, and we've got to continue to do that on meal prep and all that. But it's primarily because they cannot prioritize higher quality, slightly more expensive foods relative to lower cost, highly processed foods, or frankly, even food at all. And I think that probably can be a bit jarring for us in our esteemed Canada, that we have a significant part of the population, as evidenced by the food bank use in the last few years, that's not actually struggling with figuring out which of the foods to eat, but struggling with finding food to eat. And that's where we get into food insecurity, the day in, day out struggle to actually get food on the table. And that is being driven by a growing mismatch between the incomes of the lower quintiles of income in our country and the cost of everything. Food insecurity is directly related to the cost of rent. It's directly related to the cost of transit. It's directly related to the cost of acquiring other services that you need at prices that just were not the same previously, while in the meantime, your resources through income are just not keeping pace. We know that social security income support programs like Ontario Works and injury incomes are
disability, those things,
are relatively unchanged in the last many years, while the cost of living has gone up. And part of our calculations every year is to look at essentially whether or not people in different income levels can actually afford to survive. And it's getting brutal. It is just really getting brutal.
So I was so heartened, Alex, to see you speak out in that news story along with others, because I know a food bank can speak out about that, and there's not too much punishment about that happens, but I'm very much aware that when you're in a public agency or whatever it is, to speak out can often be difficult, and you have to manage all of the politics of it and all of that kind of stuff, with the fact that you're actually running into a crisis here, and you have a responsibility as a health unit to speak about that crisis. So we run into that as a food bank all the time, right? That we have to speak out about it. But I wonder if we've changed so much over the course of recent decades that when people actually don't know the distinction between food insecurity and food security. They see food security as a food drive or something like that. Somebody is hungry, so we'll donate or whatever it is, and we will help. But that's not what it is. Food security is this ability. You'll define it much better than I can. It's accessible to all. It's affordable, right? It's reachable. Now that has not happened, we see within our indicators as a food bank 10% more seniors coming, 20% more people that are coming that are now working. So we look at all of those things, and that's pretty standard. It's easier to judge that. How do you, in a time like now, measure the deterioration of health? Like if people aren't eating as well, or can't afford it, or whatever, and that's especially true for children or vulnerable populations like Indigenous or seniors or whatever. How do you measure that? How do you get your head around it?
When we assess the health of the population, one of the things that we always struggle with as public health is that many of the deficits in access to healthy environments or healthy conditions, food security being one, the impacts of that may not necessarily be seen for many years down the road.
Yeah.
Some of the impacts are. And so, like as an example, one of the bluntest tools that we have to measure the health of our society broadly is life expectancy. And life expectancy is not necessarily to be interpreted as how long are Glen or Alex going to live. It is a global measure of, the average life expectancy, and it shifts relative to how all of us are doing. Well, in Canada, we have seen a plateauing and an actual decline in our life expectancy for the first time in generations. And that is somewhat driven by the COVID pandemic, with people dying earlier than they would have because of a new infectious disease. Mm-hmm. But it's being profoundly driven by social economic disparities that are being manifest in opioid overdoses and other manifestations of deficit in access to social economic supports. Yeah. So and food insecurity is one of those, right? If you cannot find food and you can't afford to pay rent because you can't afford to pay rent and buy your adequate food, that creates a sustaining trauma that has mental health and addiction impacts potentially, right? When we look at the population as a whole, not everybody, but at the population as a whole.
Yeah.
So these types of metrics are critical. The other things that we look at are, childhood development and scores in schools, and we know that kids in school it's not been an easy go. Is that because they're not getting healthy nutrition in the morning? Potentially. Is it because the impacts of the pandemic had a major impact on their learning? Potentially. Yeah. So it's a multitude of things. Most directly, we just aim to we calculate something called the nutritious food basket every year, which is essentially what is the cost for a family of 4 or a single person or a couple? What would be the cost for them to feed themselves by just going to your run-of-the-mill grocery store? We're not talking about fancy delicatessens or anything like that. It would go into the normal grocery store to buy reasonable, culturally informed food for you and your family. What does it cost? And what we know is that the cost keeps going up. The cost of other things in your life keep going up, and the revenue that you're getting is low. And we know that over long periods of time, if you do not have access to healthy foods and you're living with the stress and anxieties and having to make other priorities because you can't afford food, that your risk of chronic disease, your risk of mental illness, your risk of social dysfunction, all of these things are going to increase.
Yeah. And you can see it like as a food bank or as a society. We can see it when there's a social problem. Suddenly we see more homeless on the streets, for instance, or lineups at food banks, right, or something. But when it comes to the deterioration of health, that happens over a period of time and is almost kind of invisible until it becomes visible at the end, right? So it's very hard, I would think, to raise the alarm around this stuff when people aren't seeing it happening in real time, but it is happening.
It is very hard. And it is, again, because the timeline between a family that is struggling to find food and the actual impacts of chronic disease or early mortality might be decades.
Yeah. Yeah.
But one of the reasons why I illustrate the decline in life expectancy now is, yes, it's related to other things, but part of what as you said, it was in the 80s where food banks first became a reality.
Yeah.
And the fact that we're still almost 35 to 40 years later, still dependent on something like a food bank in Canada suggests that we've actually been living with some degree of food insecurity. It's gotten worse, but we've been living with some degree of food insecurity in this country for 35 to 40 years.
Yeah.
And so I actually think the decline in life expectancy, we're running out of momentum here. And if we're asking the question why, why have we seen such a massive increase in homelessness, and we know that mental illness is becoming, why? The answers are not all captured in explanations from the last couple of years.
That's correct.
They are related to 35 years of living with food insecurity in this country.
Yeah. Doctor, I've heard you use this term food neutrality. I find it very evocative, but I don't know what it is exactly. I think it'd be helpful if you could explain to us what you mean by that. I'm not sure myself.
Totally. So food neutrality is a discussion that we have in the context of food literacy. And it's a new paradigm of how we look and talk about food. And it really is grounded in this idea that food is all morally equivalent, if not nutritionally equivalent, but that food is neither good nor bad. That donut is not bad food. That pizza is not bad food. That apple is not good food. It's just food. And food in and of itself has no moral authority, no moral equivalency. It's just food. It has different nutritional aspects to it and will play a different role in your consumption of it. And we need to continue to have conversations about how to balance all of that, but it is neither good nor bad. And the reason we're starting to talk about food in this way is that we know that we've made a habit, certainly in public health, of talking about food as good and bad. And that starts to put guilt and other emotional aspects into how people eat. Whereas I got to tell you, Glenn, like there is nothing better to me than my mom's apple pie, which is full of sugar and full of butter and just the gosh darn best thing I've ever had.
Yep.
Is it a bad food? And am I bad for enjoying it? No. Does it have the nutritional equivalency of a salad? Probably not, obviously. But it is not a bad food. And I think that helps us frame eating as not something of a eat only good foods, avoid all the bad foods. If you have a bad food, you should feel guilty about it. What we're asking for people is to consume food in a way that is globally healthy. And it is not something that actually provides moral value to you or to the food or to the people that are preparing it for you or that you're preparing it for. And that's kind of a new way for us to look at it, because over time we've realized that articulating food as bad or good can create some unhealthy relationships between people and food. And I think all of us have experienced some of that in certain degrees. And for children in particular, actually wanting them to have a healthy relationship with food itself, to say food is a normal part of how I interact with others. It's cultural. It's a whole bunch of stuff. It's neither good nor bad. And from that, I'm learning about the nutritional aspects of my food, which will help me make decisions around how to avoid chronic disease, have the energy I want, all that type of stuff. So that's really the underpinning of food neutrality. And it's a concept that really resonates with me. One thing that public health has historically done is sometimes we're a bit of the fun police, right? Don't do that. Don't eat this. Don't, that type of stuff. And it makes us sound irrelevant sometimes, because even those of us who work in public health like birthday cake. Even those of us who work in public health, like to play hockey and take a little bit of risk and bruise your shoulder up. And like we do stuff, right? There's other values that inform the decisions that we make. And so as public health, I think we're more relevant. I think we resonate more with people when we're not the fun police, when we're actually talking about how we collectively live the best and healthiest lives that we can, which includes not just avoiding all the donuts all the time, but actually engaging with food in a healthy, informative, fun, and reasonable way.
That's fascinating because, in what I've seen in the last couple of decades is it's yes, there is the food is good and bad issue that has been there. So therefore the public is driving you towards providing more, quote, good food. I get all of that, but food also has become weaponized.
Yes.
Right? It's become this thing where we're suddenly angry at grocery stores because of the price of food, or we're angry at this political party because they're not doing more about this or doing more about that. And yet, as somebody who's been to Ottawa and seeing all the different parties, they all have kids and they're all concerned about food nutrition.
Totally.
But when they come into a room, they can't discuss that. Just as a neutral thing, as you were saying, it becomes this thing that they use against one another, and I think it's made it very difficult to have an honest talk about this thing that's supposed to be basic to humanity. And I really appreciate what you're saying about the neutrality piece, because for food banks or for health units, really the public is key to all of that. That includes institutions like universities and businesses, hospitals, all of that kind of stuff. We're all kind of around that and we understand it. But the moment you start talking about why isn't there more of it, or more of a certain kind of food, then the language begins to divide people. And it's very, very hard then to get people to come into the same room and just treat it openly. And I think we need to talk more with you about that neutrality piece, because I do think that's an interest.